arms out like this for me. I'm gonna press down. Good, like this. Pull. Pull, good. Then push out, good. And push out, good. And go like this. Push up with your hand. Okay, a little weak there. All right, and then, but let's try this side. It's also weak.
It's probably because I use my hands because I lash. So I'm like in a constant position of this.
Okay.
So maybe.
Yeah, you need to work on your
yeah.
extensors.
I'm always like this on people's faces.
See, what? Okay, so this reflex is for the hand.
Okay.
So watch your hand here. See that?
Mm-hmm.
Oh my.
Mm-hmm.
Oh.
I told you.
No, not you. Oh, it's like a rock.
I know.
Oh man. All right. So how does that feel? Just me doing that.
It feels fine.
It feels okay. Like you could handle that.
Mm-hmm.
Because that's about. I need to go harder than that to break that down. But we don't start you out at the end. We start you out. Yeah, a little easier level. Okay. Chin back for me a little bit. There you go. Wow. Nope, don't like that. Let's try this one then. That's as deep as I can go. That's not enough. Oh, that right side. Anything going into your arms at all when I'm doing this?
No.
Okay. Your upper back is going to give you a workout, that's for sure. This feels good. Yeah, I'm in this little corner. All right, you want to adjust it? Let's adjust it. Just give you. Does that feel okay when I do that?
Yep.
Yep. Now, think thoughts right here. Relax, let it go. You gotta let it go though. A little bit. It's okay. We'll get it.
I'm sorry, I don't feel tense.
I don't think you realize it.
Yeah.
You're just, it's like I just pick you up and like a board, you would just. I don't like punching it, okay? Mm-hmm. I can make it go, but I like persuading it into place. Okay, so it was just a tiny one there. Chin back for me. No, hair's not in the way. Chin back. Okay, that's more or less how it should have moved on this side. It's okay. Come on and sit up for me and face this way.
Maybe it's my left side of my body. It just doesn't want to be relaxed. I don't know.
No, the left side moved.
Okay.
The right side didn't. But you have a right atlas. That's normal. It's okay. Don't feel bad. It moved a little bit for me. It wasn't like it didn't move at all. And we're going to sit this way. Yep. Sit up straight for me. Go right up here. There you go. Sit up straight. Yeah, that's it. I'm going to take it a little further. That's all it's got. Very good. Now it's closed.
Okay.
Did anything go into your arms?
Mm-mm.
Nice.
That pinky is only, I don't have 2 joints in my pinky toe on this foot.
Why?
I was born that way.
Oh, I was born that way. Still moved. Good ankles. Any ankle problems?
No.
Bend your knee, bend. Okay. Gotcha. Okay. First good pop of the day here for you. Your ankle. All right, come on and sit up for me. Yep. Hands on your hips for me. There you go. Elbow back into my elbow. Good. That's all I gotta do. Same thing. Elbow back. Right on. Yeah, that's it. Relax. No. Okay. It's okay. You're like, what is wrong? Nothing's wrong with you. Nothing. I promise. You're normal. All normal. Lean away. Good. Feels good. I like your tattoos. They're cute.
Thank you.
I like just black and white. Like it looks. Are you gonna get it filled in though?
No.
That's just the way. Okay, good. All right, so now we're gonna go face down. Finish the rest of the neck. I didn't realize how hard it is to be a lash tech.
Mm-hmm.
You're just looking down so much.
Yes, always. I can't not look down.
Aw. All right, just chin up for me. Yep, take a deep breath in. All the way out. Ooh. Wow. And again. Again. Perfect. Deep breath in. All the way out. I'm sorry. Okay, perfect. Hey. That was the rest of it. Very good. Did you hear that? Yeah. It just, I don't know. Some people's necks, I had to really persuade that thing into place. The right atlas. You feel how much I had to do? Mm-hmm. It popped how many times total?
I don't know.
Like 4?
That's like my everyday. I'll just like turn my neck and it'll pop.
But that's just one joint. That's one. No, it didn't move. The left side moved no problem.
Mm-hmm.
The right side, it took me about 4 times to get it to go in all the way.
My left side is usually the side that cracks the easiest.
Yeah, you're
so
not.
Like I can just turn and like my whole neck will crack. But like my right side is always tight.
Yeah, that just needs to be worked on more. I'll get it. Okay. Here's the green roller. How are you doing?
Good.
You okay?
Mm-hmm.
You give me a signal, okay?
Okay.
You need me to stop for a second. Oh my goodness. Can you handle this?
Yep.
Keep breathing. That's it. Oh, I see the curvature here on the right. You're tough. Either that or you have like an internal switch that just turns everything.
I feel like I just have a really high pain tolerance.
Yeah, something. Down the leg, you okay?
Mm-hmm.
And down. Let's see what we did here. You look good. Let's see. I think we did half of it. How's it feeling just you moving around there a little bit?
It feels good.
Okay. Yeah, right here is like, I mean, everything's closed in your back now, but you have like one mole back here that you might want to get. Have you always had that one?
Yep, it's always stayed the same color.
Okay, all right.
I
just have to ask.
Every time someone sees that, they're like, you need to go and get a check. I'm like, I will when it looks different than what it does.
Okay.
I know it's super dark.
As long as you're aware. No, Linnea, you can show her yours.
Oh, on my ankle?
Yeah, like, look, she's had this one. They always tell her the same thing. She's had it since she was born.
Yeah, me too.
I'm required. If I don't say it and then you get cancer. Mm-hmm.
Oh, thanks.
Yeah. Okay. There you go. I'm gonna pull here. Good.
That was my back.
That was. Yeah, that was your back. Here's another one. Oh, couldn't get that one. Can't get these. When the skin is really taut, you can't pull it. Only when it's loose, you can get like a little bit. This upper back is like, this is gonna be a work of art here to get this loosened up. All that spiel that I was telling you, yeah, well, we're gonna have to get to work here. If you can handle this. All right. Goodness. How do I want to approach this? Man, that's a lot of adhesions. You poor thing. What did they do to you? Oh.
I was telling you.
Yeah, people say, stuff to me all the time. I'm just like, yeah. You know. Oh, my goodness. Whoa. It's like a rock. Give myself a break, I mean. Doing okay? Breathe. That's it. Wow. There you go. Oh, wow. Right here. But yeah, you know, how often do you brush your teeth?
Every day.
How often do you think you should have this done?
Every day.
Yeah, pretty much. No, I only brush my teeth once a month. Now, dentists are probably going to disagree with me, but the tooth hurting is the last thing. The tooth's done at that point.
Mm-hmm.
So pain in your back, the back is special, and it's not quite, it's more forgiving. You got to get up and move in. You got to move. What I see is you got to move a little more. Okay? You got to, like, your business, or your job is to sit for long hours.
Mm-hmm.
You got to do something to unlock this rib cage. Yoga, walking, even walking would do it. You know, roll your shoulders back, keep them moving, keep your breathing deeply. Getting this, the more you move, the less this builds up. Okay. You're going to see what I'm talking about in a little bit. We call this the cheater spot. If you can't make them scream at this point. Very good. I'm going to do the other side really quickly. You're just kind of like,
Yeah, this side hurts more than the right, actually.
Okay. So, yeah, I won't go too bad on you. Yeah, this whole left side, you know, like I was saying, it's just kind of like, I was surprised it wasn't underneath the scapula. The bruises are all over here, but from the bruising that comes out, but okay, this arm needs to be up over your head. Yep. And if you ever your face gets tired in there, you can come up too. Okay. You don't have to be like plastered in there. But I was hiding my face for sure. That whole time I was like, oh my God, don't show my face. There he goes. Hey. Hey. This is the scraping.
Mm-hmm.
Does that hurt?
No.
Okay. Moving on. Well, you're very pale, okay? Like
Yes.
your skin, I'm sorry, what is that, like, politically incorrect? Fair. There we go. You're very fair.
Uh-huh.
And, we're going to see it very clearly.
Yeah, I stay pale so I don't get cancer.
Yeah, well, okay. So,
Intentional.
No. But you gotta get, I forget what percentage, but you gotta get some sun.
Yeah.
Because
I do.
Yeah, okay. If you live in Florida, you're doing okay.
I just don't get sunburned.
No, don't get sunburned. There you go.
And if I really want to be tan, I just go and get a spray tan.
There you go.
Cancer-free tans.
There you go. Well, let's see what else we got here. I'm going to pull it down to here.
Am I bruising?
Oh, yeah. It's glorious. It looks really good. Ooh. Okay, so you're going to come up off of this thing, and you're going to kind of lean over to the side. Yes, open that up. That's it. Perfect. Does that hurt? You okay? I'm good. That's a little tender. Sorry. Doesn't mean I'll stop. I'll just try another way. How about that? Okay. Okay. That's all we need to do. Now we gotta do the other side. Oh. You just haven't been worked on.
Mm-mm.
Now this is sunburn, maybe.
Yeah.
Does that hurt?
No.
Okay. I had these two guys that traveled on their bikes all the way over from like California all the way over to here.
What?
And they were so burnt, I couldn't scrape them. They were fair, like even more fair than yourself. They were all burnt.
They biked
Yes.
from California to
Yes.
Florida?
Yes.
How long did that take them?
I had a couple weeks.
Wow.
I don't know, maybe more.
That's insane.
They did it though. They said they loved the roads in Florida. They were very biker friendly.
Because they're flat.
No, because of the lanes. Because there's no.
Okay.
There's bike lanes. Can you imagine? I'm like, no. Oh, there we go. Yes. Yeah. There we go. My masterpiece.
Just like a giant bruise.
Something like that, yeah. What would you say it feels like?
That?
Yeah, the scraping. I'm gonna wipe you off.
I don't. It feels like you're just rubbing something on me. Like it doesn't feel like anything.
Does it feel nice and hot though?
I mean, I feel like I'm hot right now.
Oh,
So,
oh sorry.
So like
We turned the AC back on.
it didn't. It just feels like I don't know. It didn't feel like much.
You can just say that. That's all it is. We're just getting blood circulating. That's it. And the other side. No, the bra is covering some of it.
You want me to move it?
I'm gonna just show you this first, because most of it is there.
Oh, I'm a bruise.
You're a bruiser, yes. You bruised.
That's cool.
Ooh, a little tight on the supination as well, so we gotta go into here.
Do you think that's probably from lashing?
Yeah, you're just not clonus like this all day.
Hours.
Yeah, but yeah, see that, no, you're all right, but see, that should be able to flip.
Yeah.
You're losing the range of motion here.
I try to do like wrist stretches and stuff in between. But.
You gotta do lees, because you're not able to supinate.
Yeah.
You get stuck here. So what that does is eventually, 20 years from now, you end up having surgery, fix this bone. It's a whole process, so you don't want to do that. You gotta keep this loose. It's not hard, but once it gets arthritis, then now we have a deformity. It's not deformed yet. Now it sounds terrible. See, these are the tendons that function, that, you know, move your fingers, okay?
Mhm.
See that? They... Doing okay? You just let me know, okay? Okay. Now this I believe is your good side. We'll find out in a second. Like, how often do lashes need to be changed?
People come in like every 2 to 3 weeks.
That's a lot of work. It's too much work.
It's like acrylic nails.
Yeah, it's
Yeah,
it's like just like nails. So
So
like
you're just like the whole day in a salon doing your nails and then your eyelashes and then. Okay, now I can't see as well with the tattoo, but I can feel. Oh, I thought this side was gonna be worse. Nope, it's not. We are only as blind as we choose to be. You doing all right? Yeah, I'm fiddling with the wrist here at the same time.
That's another thing that I can do all the time. My wrists pop.
It's because they're loose. It's like your rubber band that's stretched out. They're gonna just constantly click.
Yeah, my fingers the same way. Like my thumbs, like this joint right here, this, like that.
Yeah, it's not really the joint. It's like part of the capsule or the ligaments connecting the finger, one bone to another bone. Okay, and that when you stretch that out like this glove, if I were to stretch this out, is it ever gonna regain?
Right.
It's not like a glove where it just goes like that. It looks fine. I'm not able to pull out much in this one. This one you had 2 spots. You had one here and up here. This one, is not bad at all. Oh. I'll head off the table, like looking back. I don't know. Okay, I'm gonna jump a little bit. How does that feel?
Fine.
Fall back. Yep, you're not gonna fall off it. No. That's it. Gotcha. Perfect. How you feeling?
I feel good.
Okay.
I usually, like, I can crack my lower back myself when I wake up.
Like that?
No, like,
Oh.
I can put my legs how they just were and just turn, and it usually will release.
Okay.
Should I be doing that?
That's a hard one. You're not technically supposed to be doing any of this stuff.
Yeah.
by yourself. Okay.
Craziest thing. I've never seen someone do this. I didn't even know you could crack someone's ears. I was like, what?
You're gonna find out.
Is it like the craziest feeling?
You think it's gonna? It feels weird afterwards.
Yeah, like I feel like this should hurt.
No.
It doesn't.
Maybe a pinch. Getting your ears pierced is worse.
Really?
Way worse. Lean away.
Like that is so strange.
That side doesn't have it. I don't need to pull harder than that. You don't need to pull the ear off. You just need to release any adhesions. Yeah, you hear better. I noticed immediately my hearing was like better. Like I can hear everything now. Oh no. Okay. This side doesn't have it. I can't get it. Nope. That's it. That's all that is. So if you only had like one adhesion on the right side on the bottom. So that was the one.
What is that from?
You got hit in the ear, ear infection, sleeping on it wrong, just motion that's not meant to do.
Mm-hmm.
The body puts scar tissue in there, or like a glue, okay, to keep the ear there. And then if you don't release that, it infects. There's little tubes that drain into the back of your throat from the ear, and they sit like this at an angle. And if one part of your ear is not quite sitting correctly, the tubes can't drain and people get ear infections. Also, your hearing is also directly related to it. But it can only fix so much.
Mm-hmm.
You're just getting rid of it. If you put your hands right here, just do that. Now say something. Just talk.
Hello.
Do you see how much more you hear
Yeah.
of yourself?
Mm-hmm.
Just doing that. So imagine if you release adhesions, how it's going to affect your hearing. So it's not like, oh, you can restore hearing. No, it's just you're tweaking it.
Like I feel like I'm good. Like my posture feels like I could stand straight now. Like I don't feel so, like when I first came here, I was feeling very like my spine was just so messed up. I feel good now.
Come on and stand up. Test it out.
Like I feel like my body feels relaxed and like I'm good. Like I could like yeah,
go
be good.
again.
I don't feel so, because like before I could feel like my shoulders kind of feel more open now. Like I was kind of feeling like I was like this.
Yes. Since you've done the neck, that's what. Now this is open, which is fascinating.
Yeah, it feel like I can feel it open.
Yeah, I know I don't have the light on, but here, let me. Yeah, so it wasn't the mid back that we worked on. You know what opened it was the neck.
Which is what I figured, because like my neck every morning for like the past probably like 2 or 3 weeks, I'll wake up and I'll just be in so much pain, and then I'll turn like this, and like I literally just that slight of emotion and my whole neck will go